Now, as you know, the International Hospitals Federation gives some awards. And what I would like to do now is to welcome all the distinguished guests, colleagues, delegates, ladies and gentlemen, to the 2018 IHF Awards Ceremony. This is one of those moments when you actually get a chance to be acknowledged, to thank each other and be thanked, which is extremely important in a job that often is a fairly thankless one. To start the proceedings off, I have the honour to invite to the podium again to say a few words Dr. Francisco Bellastron, again the President of the IHF, to open this awards ceremony. Francisco.
It's not a videotape, it's me again. Well, good afternoon to all of you and welcome to 2018 IHF Awards Ceremony. I'm very happy that we have come together here to celebrate and recognize hospitals and healthcare organizations around the world that have demonstrated excellence, innovations, best practice, and outstanding achievements in the programs and projects they have developed and implemented. The International Hospital Federation Awards were first presented in 2015 in Chicago, USA, during the 39th World Hospital Congress. This is the 4th year that IHF is giving out these awards. You will be delighted to know that we are now able to recognize more organizations for their impressive projects. This year, we have attracted 160 excellent entries from 118 organizations in 33 countries. Choosing the winners was indeed a daunting task. Thanks to the commendable effort of our judging panel members, we have selected 27 top entries which have proven to have significantly improved the healthcare and service delivery. In just a few minutes, we will find out who the winners and merit awardees are for our Grand Award and Excellence Awards. Before we announce the winners, it is fitting to recognize all those who have contributed to the success of IHF Award Program. In particular, we would like to recognize first and foremost the sponsors of the IHF Awards. Without their generous sponsorship and support, we will not be able to honor the organizations that will be awarded today. May I now ask our MC to invite our sponsors to come on the stage to receive our token of appreciation. May I also call upon Dr. Lawrence Lay, Chairman of the Awards Committee, to join me on stage. Please, Dr. Lawrence.
Thank you.
Thank you, Dr. Bellastron. First, I'd like to invite the sponsor of the Excellence Award for Quality and Safety and Patient-Centred Care, OSTCO Communication Systems. Mr. Chris Power, please join us on stage. Next, the sponsor of the Excellence Award for Leadership and Management in Healthcare, EOH, Mr. Derry Heron. Please join us on stage. I'd also like to thank the sponsor of the Excellence Award for Corporate and Social Responsibility, Bonexo. Unfortunately, Bonexo is not able to join us here in Brisbane. I'd now like to call the last, but certainly by no means the least, sponsor of the Grand Award, Dr. Kontai Kim, to join us on stage. Incidentally, it's important to know that Dr. Kim actually was the one who initiated the IHF Awards 4 years ago when he was president of the IHF. So thank you very much for our sponsors. Please give them all a round of applause. Without them, we can't actually have these kinds of events, nor can we actually have the work that's done in these spaces. I'd now like to call on Dr. Lawrence Lai to also say a few words.
As the President has said, this ceremony is to recognize excellence, outstanding achievements, and contributions. Apart from the award winners and the sponsors, there is a group of individuals who are particularly deserving of praise and recognition. This year's award program would certainly not be possible or successful without their immense dedication and contribution. I think you probably had guessed it. I'm referring to the members of our 4 award judging panels. Let's take a moment to thank them. I will ask Ursula to announce their names in alphabetical order, and when their names are called, may I ask them to stand up to be recognized. May I also ask you to join me to thank them by giving them a round of applause. Ursula?
Thank you, Dr. Lai. So first, I announce the members of the judging panel for the IHF Vinexo Excellence Award for Corporate Social Responsibility, and they are Dr. Mauricio Barbosa, Mr. Joseph Maria Canellis, Dr. Tom Dolan, and Dr. Tony Coe. Now let's recognise the members of the judging panel for the IHF EOH Excellence Award for Leadership and Management in Healthcare: Dr. Qasim Al-Salmi, Dr. Jan Beekmans, Dr. Marcelo Brito, Ms. Catherine Brown, Mr. Derry Heron, Dr. Bernardo Ramirez, and Dr. Adelek Bitan. We would also like to recognise the members of the judging panel for the IHF OSCO Excellence Award for Quality and Safety Patient-Centred Care: Professor Carlos Pereira Alves, Mr. Clayton Astles, Dr. Satoru Komatsumoto, Dr. Wei Shang Li, Dr. Maria Lords Ataya, and Professor Adrian Pennington. And last again, but once again, by no means least, the members of the judging panel for the IHF Dr. Quang Tao Kim Grand Award. These will be Dr. Francisco Ballastron, Dr. Quang Tai Kim, Dr. Lawrence Lai, Dr. Risto Mittinen, Dr. Eric Krayberg Norman.
Thank you, Ursula. There is another group of individuals who is responsible for the success of this year's award program. They are our award committee members. They have not only steered this year's award program, but also joined the judging panels in reviewing the entries and choosing the winners. Their names are shown on the screen. We are indeed most grateful to the good work of all our judges and award committee members. Please join me to thank them once again in our usual way.
Thank you, Dr. Lai, and also to all the judges and award committee members. Never an easy task to make these decisions to who deserves these awards. Dr. Ballastron, please join Dr. Lai on the stage as we proceed awarding the winners of the IHF Vinexo Excellence Award for Corporate Social Responsibility. I'd also like to ask Dr. Tony Coe, Director of Hong Kong Hospital Authority, and also member of the IHF Governing Council and member of the judging panel for this Excellence Award, to come onto stage to present the award. For the IHF Vinexo Excellence Award for Corporate Social Responsibility, we have 5 merit awardees. When I call your organisation, please go up on stage to receive your award. From UAE, Asta DM Healthcare for Asta Volunteers Powered by Humanity. Unfortunately, Asta DM Healthcare is unable to join us here today. Let's proceed to the next merit awardee from the Philippines. It's the Manila Doctors Hospital for Forging Oneness, Responsibility, Growth and Empowerment, the FORGE program, a community health adoption program. Jill Alvarez is receiving their award. From Mexico, Christus Magurus Systemens to Salud for Free Surgical Brigades model. Unfortunately, they are unable to join us here today. From Queensland in Australia, we have Metro South Oral Health, Metro South Hospital and Health Service Queensland, for improving access to oral health with a patient-centred focus to a vulnerable community. Dr. Stephen Eyre is receiving their award. And our final merit awardee is from the USA, Palmetto Health for Our Tithe, a commitment to caring for our community. Unfortunately, they're unable to join us. Congratulations again to all our merit awardees. Now we actually proceed to announce the top 3 winners in this category. The Bronze Award, the IHF Binexo Excellence Award for Corporate Social Responsibility, goes to Western Health from Australia for Western Health Healthcare Environmental Sustainability. Unfortunately, they're not able to join us here today. The Silver Award actually goes for the IHF Binexco Excellence Award for Corporate Social Responsibility, goes to Narayana Health from India for a program for harnessing oncological preventative and early screening activities, or the program is called HOPE. Unfortunately, they're also not able to attend today. Now we get to the Gold Award winner in this category. So this is the Gold Award winner of the IHF Binexco Excellence Award for Corporate and Social Responsibility goes to Fundación Cardinal-Infantile Instituto de Cardiologia from Colombia for Give a Life. I'd like to call Dr. Santiago Cabrera, Chief Executive Officer, to receive the award.
Hola, soy Camila y como yo, en Colombia hay más de 5,000 niños de escasos recursos que necesitan de algún tipo de tratamiento en el corazón para sobrevivir. Lo bueno es que hay una fundación que nos ayuda. Se llama Fundación Cardioinfantil, un instituto de cardiología que atiende gratis a niños que sufren del corazón, como yo. Regale una vida, un programa social que gracias a las donaciones de todos me diagnosticó a mí y a más de 3,000 niños con problemas del corazón en el 2017. Para hacerlo, la Fundación realiza 14 brigadas al año alrededor de todo el país. Así fue como pude recibir atención médica y después de diagnosticarme me llevaron a mí y a 197 niños más al hospital de la Fundación Cardioinfantil en Bogotá para salvar nuestras vidas. Únete a Regale una vida en www.donacionescardio.com y ayuda a salvar más vidas.
Thank you very much for all the committee. For more than 45 years ago, the brothers Reinaldo and Camilo Cabrera, founders of Fundación Cardioinfantil, began to build their dream to create an institution of the highest scientific and human quality to give attention, diagnosis, and free medical treatment to the most vulnerable population of children in Colombia. They knew that to achieve this goal, they would need to count on good-hearted persons who were willing to back up their vision. However, I don't think they ever dreamed the results and the joining of wills that such noble human effort would ever achieve through the social program Gift of Life as it has today. Today, with great joy in my heart, I can reaffirm that this recognition will lead us even more towards the continuation and complying with our country, Colombia. Thanks you very much for acknowledging and exalting our work. This is an award that we wish to make known to the whole world so that we will be an example of humanism and show that the united efforts can give us the best results, which is an innocent smile of each child we have saved. Thank you very much. Thank you.
Thank you, Dr. Cabrera, and congratulations to all the awardees and winners. Moving on to our second category, the IHF EOH Excellence Award for Leadership and Management in Healthcare. I would like for this to call on stage from our sponsor, Derry Heron, Executive of EOH Health Vertical, and Jan Beekmans, General Director of University Hospital Brussels. These are also members of the IHF Governing Council, IHF Awards Committee and Judging Panel. This gentleman will now present the Excellence Awards. There is only one Merit Awardee in this category. And the Merit Award goes to Hospital for Sick Children and University Health Network from Canada for their project Caring Safely, a joint Sick Kids and UHN collaboration to prevent harm and promote patient and staff safety. Unfortunately, they're not able to join us here today, this afternoon. We'll now proceed, therefore, to announce the winners in this category. So the Bronze Award of the IHF EOH Excellence Award for Leadership and Management in Healthcare goes to Ontario Shores Centre for Mental Health Sciences from Canada for Build an Innovative Culture that optimises the use of technology to advance excellence in mental health care. I would like to call John Chen, Chief Operating Officer, to receive the award. The Silver Award of the IHF EOH Excellence Award for Leadership and Management in Healthcare goes to San Juan de Dios, Barcelona Children's Hospital from Spain for Bed Management System of San Juan de Dios, an innovative system for innovative management of healthcare processes. May I call Ricard Scatel-Adjit, Head of Management Control, to receive the award. And now the Gold Award in this category. The IHF EOH Excellence Award for Leadership and Management in Healthcare goes to University of Utah Health from the USA for value-driven outcomes, implementation of data-driven approach to manage utilisation of resources and improve quality of care. I'd like to call Jeff Young, the Associate Director of Advanced Analytics and Visualisation, to receive the award and say a few words.
Dr. Vivian Lee runs the University of Utah healthcare system.
When you compare us to other university hospitals across the country, while their costs have gone up, we've actually seen our costs go down.
You've gone down? Down a lot, 30%, through a software tool they've developed to identify every penny spent, every bandage, aspirin, scalpel, IV, x-ray, how much it costs to treat patients down to the second.
What we've found is that more often than not, lower costs come with better outcomes.
So the hospital went about standardizing procedures, meds, and instruments. It turns out the most expensive hip replacement wasn't the best. In the 2-month pilot program, already $5 to $7 million in savings.
We don't just want to be chasing the dollar, we want to make sure our patients have great outcomes at low cost.
We take care of Utah like Utah takes care of each other. Maybe that's why University of Utah Health is the most trusted healthcare in the state.
Thank you, everyone. It really is an honor to be given this award and just included in the conversation and in this conference with all the excellent, inspiring work that's going on in all these institutions. And from my perspective, working in data and analytics, we're in such a field of unlimited opportunities, and it really is on a daily basis an inspiring field to be working in healthcare. So thank you very much.
Thank you, Jeff, and once again, congratulations to all the Merit Awardees and winners. We'll now proceed to the IHF OSTCO Excellence Award for Quality and Safety and Patient-Centred Care. Let me call on stage from our sponsor, Chris Power, who's the General Manager of OSTCO Communication Systems, and Dr. Tsuru Komatsumoto, Vice President of the Japan Hospital Association, also member of the IHF Awards Committee and Judging Panel, to present the Excellence Award for Quality and Safety and Patient-Centred Care. For this Excellence Award, we have 6 merit awardees. From Australia, Radcliffe Hospital, Metro North Hospital and Health Service, for a pharmacist-led hospital-based opioid stewardship service. Benita Suckling is receiving this award. From the Philippines, Makati Medical Center for the Infection Prevention and Control Program, Enrique Yabut is receiving their award. From Australia, Australian Red Cross Blood Service, Canberra Hospital and Health Service, Women's and Children's Hospital South Australia, Darling Downs Hospital and Health Service for ironing out maternity blood management, improving identification and management of iron deficiency and anaemia. Maureen Bauer is receiving this award. Also from Australia, Lady Salento Children's Hospital Child and Youth Mental Health Service, Children's Health Queensland Hospital and Health Services for Lady Salento Children's Hospital Gender Clinic and statewide service Children's Health Queensland Hospital and Hospitals Health Service. Dr. Stephen Stathis is receiving their award. From India, Max Smart Super Specialty Hospital for Project Surakashna, a quality improvement initiative to improve clinical outcomes in sepsis. Unfortunately, they're not able to join us. From Taiwan, Chiang Mai Medical Center for using ABCDE bundle to improve the effectiveness of clinical care in intensive care unit with acute respiratory failure patients. Hui Mei Quang is receiving their award. We'll now proceed to announce the Bronze Award of the IHF OSCO Excellence Award for Quality and Safety and Patient-Centred Care. The award goes to Ontario Shores Centre for Mental Health Sciences from Canada for the implementation of recovery-oriented practice. I'd like to call Dr. Rima Velji, Vice President of Clinical Services, to receive their award. The Silver Award of the IHF OSCO Excellence Award for Quality and Safety and Patient-Centred Care goes to the Mayo Clinic from the USA for optimising opioid prescribing for surgical patients. I'd like to call Dr. Elizabeth Haberman, Associate Professor for Health Services Science, to receive their award. And now the Gold Award of the IHF OSCO Excellence Award for Quality and Safety and Patient-Centred Care goes to Metro South Health, Queensland Health from Australia for gestational diabetes mellitus app and interactive clinician portal. I'd like to call Susan Freiberg, Facility Manager, to receive the award and say a few words.
Gestational diabetes is one of the most common medical complications of pregnancy. The opportunity arose for us to collaborate with CSIRO using their already developed healthcare platforms. The GDM app allows the woman to upload her sugars to the clinician portal where the clinician can see them at any time. The benefits for us are that we can see the woman's sugars so that we can review them regularly rather than when she just comes in to see us. It allows us to see the women that we need to see in a more timely manner, but also and importantly not to see the women whose sugars are well controlled as regularly. Feedback from the women who have used the app is that it's been easy to use, and for some of our busy mums who've already got children at home, it's meant they haven't had to come to clinic as frequently, but they still know that their sugars are being reviewed by our clinical team.
Thank you very much to the International Hospital Congress and for the opportunity to receive the award. As with all these things, Metro South is committed to patient-centred care. Hello, my name is Susan, and this is Wendy. And so the app is really around bringing the care out to women in the community. We have the opportunity where we service the Bay Islands, and so it was really important to have women not travel that far unless they really needed to come. As with all things, it's not just about one person. The two people here today aren't the team. The team are more than that. There's a CSIRO component who we couldn't have done it without the web platform. The obstetric team, the maternity team, and the physicians around the diabetes. So, beyond that, it's also given the opportunity to embrace innovation, which Metro South Executive and Board have given us. Thanks very much.
What we'd like to do now is proceed to the prestigious IHF Dr. Kwang Tai Kim Grand Award. I would like to call on stage Dr. Kwang Tai Kim, Chairman of Dermot St Mary's Hospital, past President of IHF, and member of the Grand Award Judging Panel. And once again to thank Dr. Kim for initiating and sponsoring the IHF Awards. So we extend our congratulations to the 3 merit awardees of the IHF Dr. Kwang Tai Kim Award. From UAE, Dubai Health Authority for Electronic Medical Records, Salama. Dr. Thalak is receiving their award. From South Africa, Frere Hospital for Frere Hospital Turnaround. Dr. Wagner is receiving their award. From Japan, Casio Healthcare for Casio Integrated Healthcare Service, Cooperation of Integrated Health Records and Human Interface. Dr. Kano is receiving their award. The winner of the Bronze IHF Dr. Kwang Tai Kim Grand Award. In this category, the winner is Wide Bay Hospital and Health Service from Australia for Wide Bay Amazing Sustainable Turnaround. I'd like to call Debbie Carroll, Chief Operating Officer, to receive their award. Now the Silver Award of the IHF Dr. Kwang Tai Kim Grand Award goes to Metro South Hospital and Health Service from Australia for Metro South Health Service Queensland, our transformation to Australia's first digital health service. I'd like to call Dr. Stephen Eyre, Chief Executive of Metro South Health, to receive the award. And finally, the Gold Award of the IHF Dr. Kwang Tai Kim Grand Award goes to Dental Health Services Victoria from Australia for value-based healthcare, a new approach to improve oral health outcomes. Dr. Zoe Weiner, the Board Chair, and Dr. Martin Hall receive this award.
principles of value-based healthcare enable us to actually look at everything that we do in a different way. How do we actually add value to all the things we do?
We need to do things very, very differently to what we've done before, and doing all the right things to produce value-based healthcare so that we're in fact improving health outcomes at the lowest possible cost we possibly can, so we can treat more people.
Through our co-design process, we've identified what the patient's needs are, and we're building that into our service delivery model.
Being prepared to learn and grow by listening to the lived experience of our clients and working with them to shape their care.
So value is not just looking at the economics or outcomes, but it's what's important to me. What is important to me in relation to my healthcare? And I think that's a fantastic thing because it makes healthcare personalised and it makes me engaged with it.
This is where value-based healthcare comes in, because it's about the outcomes for the client that are important to the client, how we work together with the client to achieve those.
Oh, this is all about patients, this is about adding value, but this is actually the first time I've seen it in action, that we're actually truly going to do something different rather than just talk about it. And so I'm really excited.
Good afternoon. I'm Dr. Zoe Weiner, the Chair of the Board of Dental Health Services Victoria. On behalf of everyone at DHSV, thank you for this incredible honour. It is truly humbling to accept this award on behalf of DHSV. I'd like to acknowledge the generosity of Dr. Kwang Tae Kim, who is encouraging innovation in the health sector through this award. I'd also like to commend all the exceptional finalists in this category. Congratulations on the wonderful, innovative work you're all doing. We started on our journey towards developing a value-based model of healthcare some time ago. And what a journey it's been. Change is never easy, but we know it's necessary if we want to meet the needs and expectations of our community. Thank you to the Australian Healthcare and Hospitals Association and the International Hospital Federation for recognising our work in this space and for organising this wonderful, incredible event that brings us all together. A huge thanks needs to go to our consumers who have been involved in this process right from the get-go and generously provided insights, feedback and suggestions on how we can create a more integrated and patient-centred oral health system. Our consumers have put up with inconsistent services for too long. We've failed to listen, really listen, for years. And yet when we asked for their help, they were there, willing and enthusiastic to work with us and bring about meaningful change. They've been waiting for this change and they so deserve it. We would not have gotten to this point without the unwavering support and commitment of all of the staff at DHSV. Change can be confronting, but they are embracing it because they genuinely care about the health and well-being of our patients. So thank you. Finally, I'd like to thank the Minister for Health in Victoria, the Honourable Jill Hennessy, the Victorian Government and the Department of Health for their ongoing support in this work. I accept this award on behalf of everyone who is helping us introduce value-based healthcare. I know we're going to do great things. Thank you very much.
Thank you, Zoe. And a huge congratulations to all of the awardees and winners for what is an exceptionally diverse, rich and impressive lineup of projects. May I now invite Dr. Ballaston again to give his closing remarks for our awards ceremony.
I hope you've enjoyed the award presentation, ceremony, and shared the joy of the award recipients as much as I do. For the award recipients, I believe that the work you all have undertaken will serve as inspiration to our role model for other hospital leaders and professionals to strive for excellence. For those of you who have not won any awards this year, please do not be disappointed and continue in your endeavor to strive for excellence in healthcare. Your good work and effort will eventually be recognized. I certainly hope to see you on the stage to receive your award next year. To close the ceremony, may I ask all of you to join me in giving all the awardees and winners a big round of applause once again. Thank you.